thank you so much for joining us today. You see two guests on the show, not just one. Frank Jordan's son is here, Mark Campbell. Mark, welcome, and thanks for coming in. Really appreciate having you here. When we last spoke with you, Mark, you were facing some knee surgery. Tell folks a little bit about that.
Well, Doug, I have to say that I ended up blowing out my ACL ligament for the second time, so I'm trying to learn a lesson here, and ended up had my first time happen was out in Nevada, but the second time I was lucky to be in Houston in close proximity with the great facilities that they have out there in the medical center. And sports injury, yeah. The pro teams, my doctor actually works with the Rockets as well as the Texans there, so he definitely has got me on an A+ program.
What were you doing to blow out this ligament? I mean, were you jogging 100 miles or?
I wish I could say so, but no, I was actually out wakeboarding, which is a high-intensity sport, some serious impacts, but, you know, it does have its down place.
Frank, do you see these guys on TV? They get this wake behind them and they hit that thing with that board and go up in the air. I think surgery needs to occur up here.
I get my exercise, Doug, waking up in the morning and getting out of bed.
Not wakeboarding. I wake up on a board? Okay. So you ended up really blowing this out. You went in, had the diagnostic test done. When this happened, Mark, were you in horrible, excruciating pain?
Well, it is quite painful because your ligament that's in your knee does have blood vessels in there, and once you rupture it, it starts to fill your knee capsule up with blood, it swells, it makes it difficult to walk, but it's not as painful as, say, a break of a limb or a bone.
Yeah, unbelievable. So you end up in the hospital. Well, what we're going to talk about today, friends, is many of us end up in the hospitals. Millions and millions of us do. And then there are nosocomial infections. Frank's going to talk a little bit about those once you get in the hospital, right? I went in to have my tonsils out, and now I've got pneumonia from breathing the air in the hospital. Nosocomial infection. Mark has kind of an interesting story because, as you recall, we invited him in here a few months ago and said, Mark, our prayers and our thoughts are with you. We're going to, walk through this with you. And he said, here's what I'm going to do, Doug. I'm going to take about 20 milligrams of beta-glucans a day. I'm going to follow a specific diet. I'm going to follow a specific regime with repairing my knee. And Frank and I wanted to have him on today to discuss that regimen he followed and how he did. We'll be right back with more.
I'm Mark Sisson, and I developed the Damage Control Master Formula, the most comprehensive, all-in-one, convenient vitamin, mineral, antioxidant, phytonutrient formula ever created. Full-spectrum vitamin E, CoQ10, alpha-lipoic acid, phosphatidylserine, green tea, grapeseed extract, beta-glucans, lycopene, and 40 other exceptional nutrients. If you are really serious about vitamins and want the maximum power of high-potency supplementation, this is exactly what you've been looking for.
Chromium, an absolutely essential mineral needed for your body to make insulin work effectively. Yet most vitamins contain little or no chromium at all. You could depend on bioactive nutrients to provide the best form of chromium for your body to absorb.
Chromium picolinate makes insulin more effective, thereby lowering cholesterol, improving blood sugar levels, and improving overall body composition. It has many benefits in individuals with type 2 diabetes.
Call today and get chromium picolinate from the one you trust. Bioactive nutrients.
KnowTheCause.com is new and it's ready for you right now. Check out the featured articles by Know the Cause host Doug Kaufman, like Why Don't Doctors Know This? Click on the Know the Cause bookstore, which features books like Eating Away to Good Health and the Fungus Link 1, 2, and 3, plus many more. Watch shows that link cancer with fungus, watch shows on dieting and clean air, and learn all about herbal remedies that improve your body's performance. Thousands a day are clicking on now for the most informative website in health television programming. KnowTheCause.com.
Long Life Unlimited continues to carry the products that you've come to love. Organic Orange TKO, Rafa Remedies, and the new Rafa Ice. Call Barb and Frank Long at 877-433-3962 or log on to longlifeunlimited.com. Long Life Unlimited, bringing hope to the world, one person at a time.
And welcome back, friends. Thanks for joining us. Listen to this. Now, this has to do, Frank and Mark, with another hospital procedure. This has to do with radiation. Would those of you who have been through radiation, surgery and then radiation, breast cancer, etc., prostate, would you wish that your oncologist would have had this information? This came out of the University of Louisville in Kentucky in September of '05. Mice were treated for 12 days with beta-glucans. That's what we're talking about today, beta-glucan. You'll want to write that down. And also, I'll tell you how to get a free bag of them. Yeah, it's really good. And exposed to a sublethal dose of radiation. Sublethal, it wouldn't kill them. The beta-glucan treated animals had approximately 40% more cell formation units in the spleen than untreated mice. But listen to this, it gets better. When beta-glucan was given orally, survival of the animals receiving a lethal dose. So you give it orally to these mice, and they give them a lethal dose of radiation. Sound familiar? A lethal dose of radiation. 40 days later, 30% of those mice are still alive. The ones who didn't get beta-glucan, 3% of those are still alive. So you can do the math on that. It increased greatly your chance of surviving radiation by huge amounts. So beta-glucan, when I tell you Mark was taking beta-glucan, if Frank was my dad, I'd be taking beta-glucan IV every day, over and over again. But beta-glucan was one of the things you insisted you wanted to take throughout your recovery. You took it both internally, and I can see you with ImmuSkin, you know, rubbing it on your leg. How'd it go?
Oh, it went quite well, Doug. I tell you, before surgery, you have to prepare yourself because it's such an invasive process. Anytime that you cut the skin, you're promoting an opportunity for bad things to get in there. Plus, you want to reduce the scarring and prepare your own system for repair.
So you took 10 milligrams once or twice a day on a regular basis. What else did you take, Mark?
Well, I ended up taking my beta-glucan, like you said, coenzyme Q10 for the mitochondria and your energy production, grapeseed extract to help to get rid of the free radicals in the body that are created from the anesthesia, as well as the damaged skin. You also want to take caprylic acid to stave off any chances for fungus because, you know, as fungus is, it's a resilient pathogen and will get in there and cause problems any chance it gets. And also probiotics to prepare my system because, you know, every time that you go in for surgery that they actually give you antibiotics to stave off any post-operative infections.
Okay, now Mark, we're out a couple of months now. What was that, 2-3 months ago?
It's been about 3 months ago.
Is that 3 months? Boy, time really flies, Frank. And where are you today in your recovery? I have read that athletes take about a year to recover from this. Where are you in your recovery?
I'd say I'm between 80 and 90% right now. My doctor, he's a great guy. He really pushes me. He gives me a hard time whenever he wants me to work harder, and that along with about 3 hours of PT every day, incorporating it, thankfully, with Frank's blessing at work.
Blessing? You let this guy off 3 hours? Cut, edit, because we don't want our guys around here to hear that. Nobody gets 3 hours off.
Well, what's great, Doug, is that I might add Mark is in charge of our laboratory facilities for producing ammunition glucan. So I couldn't let him off if I had to. He's got to be there. So we set him up a facility within the offices. But long story short, anytime anyone has surgery, you're going to have a wound invasion because you're cutting, you're making an incision. As Mark said, what can come in? You've got uninvited guests, bacteria, fungi, viral infections. Then the second thing is you've got to remember you're going to have inflammation, as he said. And here you've got your immune response. Inflammation is your immune response responding to begin first to stop the infections that can come from the things I mentioned, and then also to start the repair at the wound site. That's what they do. Then the third thing is you have anesthesia when you have surgery, or most do, and the most common surgery is a dental extraction. People don't think of, you know, going to the dentist as surgery, but indeed it is, and those teeth have direct roots to many organs in your body. So the third thing is the drugs you take. First you have anesthesia, and those are, they put you out, but they can put your body in extreme trauma in other ways. And then, as Mark said, the antibiotics, which mean, as we both know, against life. Fungus can certainly take over there, so a good probiotic is essential. But the NSC 100 is absolutely, I don't mean something I suggest here. You just have to do this, particularly chemo and radiation, because you're suppressing your immune system by going, it's at war. And so you've got to bring it back up.
But Frank, the science around this beta-glucan, I can't believe this isn't a prescriptive drug, number one. But number two, talk about him needing white blood cells and immunity.
Well, Doug, when your immune system is suppressed by surgery, chemo, radiation, you've got to get your immune system back. And those keys are the white blood cells, called the phagocytes, and then your red blood cells, even plasma cells. We forget the plasma cells are actually create the antibodies in our body. A lot of people don't realize that. So we've got to come back. That research you're saying, and much more, says that the MG beta-glucan and the immunishin glucan products, the NSC 100 extra strength, which you would want here, and the original formula, bring back white blood cell counts, produce red blood cells for energy and oxygen, and also help reproduce the plasma cells. It's just absolutely essential, because you've also got cells that have been wounded. Not just the wound you're repairing, but you have cells damaged, so you have to get those out of the body and get new healthy cells in so that these other things don't come in, the viruses, the bacteria, and again, the fungi.
A nosocomial infection, like we talked about. Mark, I'm sitting here as Frank's talking, thinking how different of a world is this today? We're talking about enzymes. We're talking about nutrients you took. We're talking about a physician who pushed you. We were talking during the last break about normally at 6 weeks you're supposed to give a 90-degree lift on this leg. Well, at 12 hours this doctor had him pushed to that. But these are things, believe me guys, before surgery, you ask any surgeon, what surgery are we going to do? You're going to do the surgery. What do I need nutritionally? Nothing, a little ice cream afterward. I mean, there is no knowledge. We are breaking ground here talking about what you did. And that's what I would do, by the way. The results at 3 months are kind of staggering to me. Are they to you? Because I looked at your knee and you have what used to be holes in your knee where they held your leg up on that thing. Are you feeling good now?
I'm feeling quite well, Doug. I tell you, it still does get a little sore whenever I stand up for extended periods of time, but one of the most difficult things to do with the recovery is getting that muscle back, because your brain sends a signal to stop that muscle, to immobilize it in a way so that you don't get in there and injure it further. And a lot of the things that is difficult to get is that muscle tone and being able to get it to fire when you want it to, as well as the proprioception, which is being able to make your foot do what you want it to do.
I mean, it was out of control. It wouldn't do that before.
No, it just wobbled around a little bit, but I could still walk.
Do you realize you will never be a place kicker for the Dallas Mets or whoever we are, the Dallas team? I mean, that's absolutely earth-shattering what you went through. When we get back, I want to talk to you and Frank a little bit. I know you two have communicated this for the past 90 days. What effect do you think this had? The beta-glucan, the enzymes, the diet, the pushing yourself on this machine at 12 hours to go where 6-week people post-recovery go. So I want to talk to Mark about that, and then Frank a little bit more about free samples. We'll be right back.
Did you know God designed your immune response to protect you against the things that make you feel bad? But we weaken our immune soldiers by eating, sleeping, and exercising poorly. To help, I've developed and patented MG immunishin glucan, proven more than twice as potent as competitors. Your immune cells nutritionally become an arsenal of defense fighting bad things that make you hurt, sneeze, and wheeze. I've arranged for a free sample of immunishin glucan to see for yourself. That's right, free, no shipping. Don't wait, call now.
I love those earrings. I need to get some for...
Are you okay?
This lunch isn't agreeing with me.
Wait, I can't believe we haven't talked about this before now. About 6 months ago, my doctor recommended that I change my diet and start taking Dr. O'Hara's probiotics. Ever since I started taking them, I feel fantastic. They are amazing.
Dr. O'Hara's probiotics, established by science, endorsed by doctors.
So many of you have heard about this website, Know the Cause, and you watch the show every day, and you've learned about the books, but you haven't bought yet. Now we have a chapter of each book, there's 7 of them, on the website Know the Cause. Scientists are now finding out that the same drugs used to kill toenail fungus are stopping cancer from spreading. What about childhood diseases and adult diseases and men and women diseases? Are they all due to fungus? Go to knowthecause.com and find out. Joins us today. He is Frank Jordan's son. Mark had a mishap. Mark was a professional wake man, not a walk man. He was a wake man. These are guys who get on like one ski. Do you do it on one or two?
It's actually a board, so both your feet are in the same spot.
A surfer. Do you do it on 2 boards or one? You do surfing on 1 board. So Mark stands on this board and he hits those wakes and he goes way up in the air, and while he's up there he does somersaults. Well, he landed wrong one time and really blew his knee out. So the doctor said you have to have this surgery. I thought it'd be a wonderful idea for Frank to come in with Mark and give us some kind of an idea of post-surgical, after surgery's done, what did he take? Did he recover more quickly than the average human being? What does his doctor feel about his recovery? And most importantly, how can that be rolled into your life? Most of us will face surgery. You know, I haven't yet, but we all at some time have to face surgery. And you faced it at a very, very young age. So what is your doctor saying about recovery, about flexibility, about immunity, etc.?
Well, I tell you, Doug, the recovery a lot of times has to do with what you do prior to surgery, even so much. I needed to make sure that I was in top condition, that I eliminated the sugar from my diet, increased my vegetable intake, and took my beta-glucan as well as my multivitamins. So that allowed me to prepare myself to go into surgery, which then segued into post-surgery, where, you know, you just have to treat yourself so much better.
Frank, proud of him, huh?
Very proud of him, because, you know, you can talk the talk, Doug, but to walk the walk. We have been talking to our viewers, great, and as you said, the Lord said, my people perish from lack of knowledge. Well, we have knowledge, and you and I can help impart understanding, but then you got to have the wisdom to turn the switch on in your life. And in your life, our lifestyles have to be changed. The urgent has to take a second place to the important. And if you want to live a quality life, your immune system is critical. 20 trillion out of 100 trillion cells in your body, the good Lord made immune cells. The reason? He knew you're going to be tested. He knew you're going to have external assaults on your body. Some may be a little self-inflicted, but you know, but internally we also have diseases. We age. All of these things are attacking our bodies. That's why we say we're at a body war. And we have ammunition to help win that body war. We named it ammunition because of the importance of the immune response. But this is particularly important. We now have plastic surgery, cosmetic surgery. That's called elective because we choose to do it. We don't have to do it. Personally, I don't think that's a good idea, but if millions of you are going to do it, just as Mark did, prepare your bodies. Get your immune systems up. These invade, they wound. You need repair, and you have the possibility, and you and I both know of a lot of instances where it didn't quite turn out like the video you saw before you started. Gallbladder, laparoscopic surgery now is so prevalent. It's just so easy. Let's go in and have a little surgery and come out tomorrow morning. Surgery is dangerous. I would just say don't unless you have to. So if you're going to do it, just like Mark said, prepare your body, exercise, get in better shape, lose that 8 or 10 pounds, get your immune system up with immunishin glucan and the coenzyme Q10, the immunishin CoQ10. If it's prostate, we have a great formula there. If it's dental, I would take the Immune Plus, which has got the grapeseed extract and other things Mark was talking about. We can help you help yourself. We also have a great free report on surgery. We have another one on chemo and radiation. You just call us. It's absolutely free.
In addition, folks, to the free product, any of you can pick up the telephone and call and get a free, they'll pay for shipping and everything here. Mark, I have a question for you. How long were you in the hospital after the surgery?
Well, they had me overnight, and I believe, Frank, they had me moving around about 3 o'clock the next day.
I will say Mark didn't know really where he was.
He may have been there a week
after surgery, but he came out. It was actually a 24-hour observation period.
Do you tell the doctors in the hospital, the recovery nurses, et cetera, look, I brought this. I just want to take a couple of these a day. Did you continue throughout the entire time, right up to the surgery? I know you take this on an empty stomach. Did you continue through recovery taking this?
Yes, I did, Doug. I did take it prior to the 12-hour period prior to surgery where you're not supposed to have water. I wasn't going to infringe on that and wake up in the middle of surgery with my anesthesia not working, but beta-glucan won't do that. Let me make that clear. But post-surgery, it was a free-for-all. I really increased my beta-glucan because I knew that getting those pathogens or having the possibility of pathogenic presence in my body, I didn't want to complicate my surgery.
Would you take this the rest of your life? I mean, are you on board with this for the rest of your life? And you're a young guy. Frank and I, talk about this often. Should young people be on beta-glucan?
I would say so, because so many of our life choices, whether if we're going out into public settings where we congregate with more individuals, we travel more in some cases, so that you are exposing yourself to more pathogenic presence and that possibility of developing some sort of a condition. So yes, I'm sold on it. I actually have a stash of beta-glucan off to the side, so in case.
He's directly taking that tube that spits out all the pills. I can see his pockets as he walks out. It's like if I was working at the Mint, I'd have like $50 in my pocket as I walked out of there. Frank, there is an argument to be made here for yet another supplement. I mean, people who come on this show, Mark Sisson does such a good job, Guy, they talk about the importance of every day taking a vitamin supplement, and most Americans now get it. An argument has been made since 1948 on taking beta-glucan. Why hasn't the world picked that up yet? Because it can't be patented, and so drug companies don't have it?
It is a natural product, Doug, and only synthetic products can have what's called a chemical footprint and be patented. So this is natural, so you're never going to see the big pharmaceuticals come in on this unless they can tweak it or make it synthetically similar. To date, that they have not been able to duplicate that. We have done most of the medical school research for years, and we have got it down now to where it's 2 to 10 times, more potent than competitor glucans. We know why. We micronize it so you get a very fast response, a very potent response, and that's the key. You want to get over what you've got if you've got something, but even more important is what we don't get. Now, the glucans don't pop, tingle, or fizz. They don't do that, but they will help you where you don't cough, sneeze, or wheeze, and that's really our objective. It's what doesn't happen. And that is, if aging is the sum total of life's negative events, if you don't have negative events,
you're not going to age.
You're not going to age. So that's really the key, and that's where we are. Free sample, free shipping. Join the club, 24% off. That has free shipping, and you get a free product after your first order. You just can't beat that.
I agree with you, Frank, and I thank you very, very much for having those free samples, both you and Mark. I know you work hard on that, Mark, also. Listen, time for Doug's testimony. I don't do this, but I've just got to tell you, everybody was sick in the winter. Everybody in the studio except the old man. I decided, Frank brought me a research paper, 6 months ago or so, and it said not only does this beta-glucan modulate the immune system, it also stimulates the immune system. And I thought, wait a minute, I'm 29 years old. I'm not getting any younger. I want to take care of this old body. And so I started taking it day after day after day. And I'm telling you, when all the young guys at the studio got sick and the old man didn't, I'll bet you Frank got, about 12 phone calls he didn't normally have. We'll be right back with more.
KnowTheCause.com is new and it's ready for you right now. Check out the featured articles by Know the Cause host Doug Kaufman, like Why Don't Doctors Know This? Click on the Know the Cause bookstore, which features books like Eating Away to Good Health and the Fungus Link 1, 2, and 3, plus many more. Watch shows that link cancer with fungus, watch shows on dieting and clean air, and learn all about herbal remedies that improve your body's performance. Thousands a day are clicking on now for the most informative website in health television programming. KnowTheCause.com.
Unfortunately, we can't remove all the stress in our lives. But with all-natural Proloftin, we can change the way our body reacts to stress. Imagine waking up more refreshed, more focused, and not so upset by life's little annoyances. Imagine sleeping better at night, even losing some of that unwanted weight. It's all possible when you reduce stress with fast-acting Proloftin, the capsule you take every day just like your vitamin. Order Proloftin today.
So many of you have heard about this website, Know the Cause, and you watch the show every day, and you've learned about the books, but you haven't bought yet. Now we have a chapter of each book, there's 7 of them, on the website Know the Cause. Scientists are now finding out that the same drugs used to kill toenail fungus are stopping cancer from spreading. What about childhood diseases and adult diseases and men and women diseases? Are they all due to fungus? Go to knowthecause.com and find out. About this as we close for today. Look at the products. You can get a free sample of that product. Any of you can. A physician's desk reference Health, PDR Health, says this: high-risk surgical patients were given a placebo or beta-glucan in a double-blind randomized trial. Those receiving the beta-glucan, what we're talking about today, had significantly fewer post-operative infections than did the controls not receiving it. They also had decreased antibiotic requirement and shorter length of stay in intensive care. Be still my heart, and I ask why doctors aren't using this. Think about that. Fewer antibiotics, shorter time in the hospital, intensive care time went down, fewer pills were given. These people recovered more quickly. Mark, you're now feeling back to, what'd you say, 70–80% or more?
Yeah, a little bit more.
When are you going to wakeboard again?
Don't think I'm going to get to. I'll just get to watch.
So did Frank inherit that? Now you're starting the wakeboard?
Well, Doug, at our age, we start serving on boards and we get off the,
off the wakeboard.
Off the wakeboard.
And let me just ask you, did you share this information about the beta-glucan with this doctor you really liked?
I did tell him post-op, just to let him know that there's a reason why I'm healing so well, that the scarring is minimized and the progress is
What did he say, man? I'm dying to hear what he said.
Well, he's quite progressive. He's a smart fellow, and he definitely believes in the research.
Frank, are we seeing more and more physicians, chiropractors, nurses contacting you?
It is amazing, Doug, how many we truly are, including even veterinarians, by the way. But what we hear so often, because of what's called standard of care, standard of practice, is physicians are not allowed to really come to the nutritional side and the natural side in some instances. And so they'll say, I don't know what you're doing, but based on your test, keep on doing it. In that case, when you can't, beta-glucan, ammunition glucan.
The story is so wonderful the way it ends here, because Mark gets to answer some of the phones over there also. Frank and Connie and the whole family. If he's guilty of anything, it is nepotism. The whole family is over there answering the phone and working. And Mark, what you hear over there, probably in school you never heard. I mean, the testimonies.
Oh, you're right, Doug. I mean, we get so many people that just tell us the life-changing differences we make, and it makes it all worth it, all the hard work.
It really does, and now your recovery, quite possibly because of it. Thank you guys both very much for coming in today. Really appreciate you. Do you want more information on this? Would you like a free sample? How about a free newsletter? How would you like to sign up free for the club where you get a 24% discount? They can make it happen, but only if you call. We'll see you next time.